Marie, thank you. As the PowerPoint was not widely kind of seen around the room, is any chance of getting that up on the 3IE website?
Sure.
Yeah, great. Okay, terrific. Well, let's move on then to Daniel Gilligan, who's going to tell us about Harvest Plus.
Thank you, Michael. Yes, I'm going to present primarily findings of an impact evaluation with a large number of partners. I'll show you the list in a minute on the impact of Harvest Plus's Orange Plus Sweet Potato project in Uganda and Mozambique. But I'm going to start off with just a moment. Michael already gave a preface, but on the role of evaluations as a learning tool. I'll then spend most of my time on the findings of the study and a little bit then on our lessons for cost effectiveness and how to scale up an Orange Plus Sweet Potato intervention. So this is an example of a quantitative, randomized controlled field experiment that was conducted in order to look at the effects of OFSP as an agricultural intervention that had explicit nutrition and health objectives. And I just wanted to emphasize that I think evaluations are a fantastic tool for learning about what works, but not just what works, but why things work. I don't think all evaluations have to be randomized. That's a very useful way to construct the counterfactual. It's the most convincing, but we've used at IFPRI a lot of other techniques that I think with the right data and the right contexts can be very effective as well. But one of the limits of an evaluation is that you can only actually, in a very well-structured evaluation, you can only compare a certain number of types of programs or change a certain number of the program components. So you really have to focus on what's the highest priority for you in terms of what you want to learn. But I think particularly for the objectives of this conference, learning about agricultural interventions with health and nutrition objectives, I think this is a very useful way to go. Generalizability can be an issue, so I'm going to show you an example of one where we did this evaluation in 2 countries, which gives us a better feeling for whether results are very context-specific. So this was the Harvest Plus Orange Plus Sweet Potato project was the first, they call it the Reaching End Users Project. It was the first time that they had the first crop that was disseminated by Harvest Plus, and so they boldly invested considerable resources in a careful impact evaluation. Orange Plus Sweet Potatoes was disseminated to 24,000 households in Uganda and Mozambique, starting in 2006 in Mozambique, 2007 in Uganda. The viability of this, the goal of the project is ultimately that you can improve vitamin A deficiency, reduce vitamin A deficiency through consumption, promoting adoption and consumption of Orange Plus Sweet Potato. Whether that's viable as a public health intervention depends very much on getting high adoption rates and on the crop actually diffusing to other households so that you can keep the cost down. And so I'll show you some results on that. Just in terms of context, OFSP is a secondary staple in Mozambique, a primary staple in Uganda. Vitamin A deficiency rates among children under 5 are much higher in Mozambique than in Uganda. So the OFSP project was structured as a 3-pronged intervention. Not only were OFSP vines given out and some trainings on farmer extension to grow the sweet potato, but also demand creation, behavior change trainings were intensive, and also some work on marketing as well. The goal of this evaluation in terms of a learning exercise was about cost effectiveness. So we compared what we cleverly called Model 1 and Model 2. Model 1 being the intensive version, the more costly version, that had 2 years of dissemination of vines and trainings. Model 2 was the same as Model 1 in the first year and then dramatically reduced effort and costs in year 2 in order to compare which approach would be more cost effective. Just in terms of context, again, there were some differences in the programs. In Mozambique, we only have 1 agricultural season a year. They disseminated vines at the beginning of each season. In Uganda, it was possible for farmers to keep the vines between seasons, so they gave out vines only once. And then over 4 seasons, 2 years, the farmers kept the vines going. So the evaluation design, as I said, was a cluster randomized field experiment, a baseline survey at the beginning in both countries, an end-line survey either 2 or 3 years later. The farmer groups or church groups in Mozambique were randomly assigned to either the intensive Model 1, the less intensive Model 2, or a control group. And we had pretty intensive data collection with a socioeconomic and agricultural production survey, as well as a dietary intake and nutrition survey. And we assessed a number of other outcomes than just the few that I'm going to show you here. I can really only give an overview of results. I want to mention just the large number of partners that were involved in this study. There's a list of the organizations that were involved in the implementation teams in both countries. We worked closely with them, both, as Michael said, it was a good example of implementation and research having to work closely together while still maintaining the independence of the evaluation. And also the co-authors on the impact evaluation report are listed here as well, and it was a good example, I think, of economists and nutritionists working closely together on a quantitative evaluation. So here's the first set of results. This was the impact of the project, this integrated project, on adoption of orange Swiss sweet potato. And I've actually collapsed the effects on adoption from Model 1 and Model 2 because they were not significantly different. So this is the kind of average effect of the two models across countries. And what you see there, this is just the level of OFSP adoption rates at the end of the project. So there's a single difference end of project estimator. So we're looking at, in the control group in Mozambique, you had 9% adoption, and in the control group in Uganda, about 4%. And then that large orange bar is the level of adoption at the end of the project. So it's essentially a 68% effect on adoption rates in Mozambique, a 61% effect in Uganda. So in Uganda, where you gave out the vines at the beginning, this was 4 seasons later now. Still almost 2/3 of farmers in the project had OFSP in their fields. Next, I wanted to show what farmers are doing with the crop once they receive it. So this is showing the share of orange flesh sweet potato in total sweet potato area. In both countries, the orange flesh sweet potato were given out in areas where white or yellow flesh sweet potato were available and commonly grown by a large percentage of the sample. The project increased the share of OFSP in total sweet potato area pretty sharply. So these are difference in difference impact estimates. So what we're doing is we take the change in the share of OFSP in sweet potato area in Model 1, say, and subtract from that the change in the control group, and that's how we measure the impact. And in a randomized study like this, you can say that the size of this effect is actually driven by the project. So we find that the project has caused a 54% increase, roughly 54, 55% increase in the share of sweet potato area that's now orange flesh sweet potato in Mozambique. In Uganda, it was slightly lower, but still about a 45% increase in the share of area that's grown now with orange flesh sweet potato. So part of what was interesting about this for us is that the biofortification project here seems to be working exactly as we expected, in the sense that there was not a substantial effect on total planted area. The effect was that people were substituting the less nutritious white and yellow orange sweet potato varieties for now the very nutritious vitamin A dense varieties. So it's doing just what biofortification had hoped to do, which is to increase the micronutrient content of the staples that are a common part of the diet. And here is our sort of punchline estimates. These are the effects of the project on dietary intakes of vitamin A. There were substantial effects on 3 groups that were measured in the study. Children aged 6 to 35 months, children that were aged 3 to 5 at baseline, and then adult women. I'm only showing the results here for the youngest group because they're of the highest priority for nutrition intervention. Again, what you see here is a net increase, again, a difference in difference increase of more than 200 micrograms of retinol equivalents per day in children in this age group. In Mozambique, slightly smaller, but on average, again, around 200 micrograms per day of children in that age group in Uganda as well. That, in terms of effect size, that effect size is actually roughly equal to the recommended intakes of vitamin A for a child of that age. So this is a really substantial effect. Also, we were able to show conclusively that this increased vitamin A intake is actually due to the orange flesh sweet potato. So OFSP was responsible for 70% of total vitamin A intake in Mozambique. This is, again, coming from detailed 24-hour dietary recall interviews with mothers. And OFSP was responsible for 53% of vitamin A intake by the end of project in Uganda. So, thanks. So what does this mean for cost effectiveness? Model 2 was substantially more cost effective than Model 1 because it was about 30% cheaper overall to do Model 2. And the effect size is actually across a broad range of outcomes, much broader than I've just shown here. Were very similar. There were not that many cases where Model 1 was more effective, so that makes Model 2 much more cost effective. And we think that there were further cost savings possible from Model 2 in terms of reducing the complexity and the effort that goes into some of the messaging. So I'm showing average costs here for the project overall, which as a sort of first start is relatively expensive, but the marginal cost of actually doing this ends up being about $18 to $27 across country of essentially adding new communities. And we think that those costs could be brought down substantially through greater diffusion, encouraging greater diffusion, and some other cost savings. Also, once the crop gets established in the fields, if they're maintained by farmers over time, that actually reduces the cost effectiveness even more. Whereas for supplementation, you need to go back every year and provide new supplementation. So we have some more work coming up on this. As Marie mentioned, with support of 3IE, we're going to go back to Uganda and look more at sustainability and diffusion, and hopefully learn a bit more about what makes diffusion work. Thank you very much.
Thank you, Dan. Just to check, that will be on a web page somewhere available,
Yes,
or the study is?
Yes. We're getting nutrition papers into journal submissions first, and then all of these things will be up on the web pages. Give us a short period for that.
I'm a great fan of journal publication. Great. Okay, thank you. Okay. Really interesting. Let's move on to Laura Iannotti, who's going to tell us about treadle pumps in Africa. Kickstart.
So I'm going to do 3 things in this presentation. First, just give you a brief background of Kickstart program and our evaluation. Second, outline some of the design innovations and the pathways that we're exploring. And then finally, give you some of our preliminary findings and early lessons learned for this evaluation. So to begin, Kickstart International is a social enterprise, a nonprofit organization that's dedicated to advancing solutions to social problems using a market-driven approach to development. Their primary objective is to alleviate poverty in sub-Saharan Africa. So about 20 years ago, they began selling irrigation pumps and other productive assets. Currently, they have now sold to 150,000 farmers in 20 different countries of sub-Saharan Africa. Their approach was and continues to be using a business model in which farmers, primarily women, purchase pumps from local suppliers. NGOs also purchase and distribute the pumps. The human-powered irrigation pumps range from the small hip pumps, which cost about $35 US, to the super moneymaker pump, which costs $100 US. So years of observation, anecdotal evidence, and internal performance monitoring showed that there was tremendous potential for impact, extending even beyond poverty into the realms of education, health, and nutrition. In recent years, Kickstart recognized the importance of an external evaluation. So in 2009, they partnered with IFPRI and Washington University in St. Louis to conduct this evaluation. Funding was received from 3IE, Gates Foundation, and Voxtra. Now, the primary intent of the Kickstart evaluation is to look at poverty reduction. However, it is also uniquely designed to examine the health and nutrition impacts of an irrigation pump. It's a 3-year longitudinal study looking at the differences in pump ownership between control and intervention groups. The first innovation actually lies in the construction of the intervention and control groups. So, similar to others in the social enterprise field, Kickstart implicitly places value in particular characteristics of their clients or the small farmers. So in particular, they place value in the entrepreneurial spirit and a willingness to invest in an agricultural input. Thus, during the planning phase, a great deal of attention was focused on constructing the comparison and the control group. And it was the control group that gave us the most difficulty. We ultimately decided that we would use a group of farmers who had recently purchased the pumps but had not yet realized the benefits to be our control group. So very simply defined, the control group includes 2 cohorts of late pump buyers, and the intervention group includes 2 cohorts of early pump buyers, one owning the pump for 1 year and one owning the pump for 2 years. Another novel feature of the evaluation is that we are using cell phone technology and EpiSurveyor software. We're putting in GPS coordinates to be used for later use in analyses, including like the social networking analysis we'll be doing. The 2 main pathways that we're looking at for positive health and nutrition outcomes are the following. Pump ownership, leading to increased food and agricultural production, leading to increased income and assets. This then may lead to improved health behaviors, such as purchasing of water treatment supplies like WaterGuard, or the purchase of ITNs. We're examining all of that. Increases in household and child consumption, and then ultimately on children under 5 anthropometric outcomes. We're looking at the second pathway, which I think is an interesting pathway. We think that pump ownership could actually be increasing water supply for use for domestic purposes, so that then in turn leads to better hygiene and sanitation practices and ultimately decreases in infectious diseases. On the negative side, poor water management is a pathway we're examining for malarial outcomes, both at the homestead and at the plots. We're looking at a range of factors, including agricultural production, irrigated rain-fed livestock, assets, rural services, sanitation, water use and hygiene, mental health and aspirations, household food consumption, young child food consumption, and anthropometry, and morbidities, especially the morbidities related to water and sanitation, so diarrheal outcomes, respiratory infection, trachoma, and guinea worm. Now, I'm going to present a few of the preliminary findings with the caveat that the data cleaning is still going on, and then conclude with some of the early lessons. So in our view, these findings do suggest the possibility that some of these pathways could be, in fact, occurring. The baseline data has been collected for cohort 1. We have 1,264 households, 614 from Kenya and 650 from Tanzania, and 458 children less than 5 years of age. We found that in the dry season, people are in fact using a water source far from the homestead for domestic purposes, allowing for the possibility that the pumps could improve water access. So 13% are using a natural spring or stream, and 11% a public well. Few households reported using the pump yet for domestic purposes, unfortunately, but only half had put it into use yet for irrigation. This is the baseline. The average time to collect water during the dry season was 15 minutes, with a high degree of variability, taking up to 3 hours, allowing for the possibility for labor time savings for women. We did find adult women are the ones primarily responsible for water collection. In terms of health behaviors, only 1/2 of the sample treat water currently. Few use flush toilets, no surprise, 20%, and rely on latrines in nature, again, opening the possibility for the pumps to improve sanitation. Household food consumption was greater for cereal, vegetables, legumes when compared to meat, fish, poultry, dairy, and fats. We are hypothesizing this is where a big nutrition change may occur based on the food type demand elasticities. Morbidity prevalences were aligned with demographic and health surveys in these countries, which was heartening in terms of the validity of our measures. 13% of children under 5 had diarrhea in the last 2 weeks, 30% with fever, and 9% with acute respiratory infection. Very few reported cases of trachoma or guinea worm. Now, I conclude with 5 early lessons learned from our evaluation. Number 1, many people are talking about it at the conference, but it really did have a nice effect. The transdisciplinary nature of the study team and our partners. in my view, fostered a lot of innovation and creativity and compromise in the sort of convergence of methods and techniques. All involved partners are working to, this is number 2, are working toward evaluation legacy within Kickstart. And doing that by involving the M&E staff of Kickstart International. Number 3, we think that more pilot testing would have been very helpful for the cell phones in particular, and for the EpiSurveyor. Number 4, the logistical challenges of this large-scale evaluation have been considerable. Reaching these very remote, hard-to-reach communities is important, but it has been very costly and even times dangerous. And finally, we do think that the results from this study may lead to some new thinking and new approaches in agricultural development to improving nutrition and public health. Thank you.